Hello, Elizabeth Gerard with Whole Body Healing, Acupuncture and Wellness. We are an acupuncture and Chinese medicine clinic specializing in pain and stress management. Today I want to talk about acupressure. What is acupressure and how can it benefit you? Let's get started. So what is acupressure? Acupressure is the same as acupuncture, except rather than using needles, you're using pressure from either your hand or some other massage tool to stimulate a specific point on the body for a therapeutic purpose. These points are good for helping to relax muscles, they're good for digestion, they can also regulate hormones. The point that the woman is using in the picture is called spleen 6. It's about 3 inches above the ankle, and it's used for digestion and regulating hormones. How can acupressure help you? It relaxes muscles and decreases pain, improves circulation, increase your immune system, reduce anxiety and stress, help have a better quality of sleep, increase your energy and mood, less bloating and digestive upset, helps regulate hormones, and really just gets you feeling better. How do you know when to get acupuncture versus acupressure? Well, I'm an acupuncturist, so I tend to use a lot of acupuncture. If you come to my office, chances are I'm going to do acupuncture on you. But there are specific cases that I may use acupressure. Babies and young kids tend to be a little bit sensitive. They don't like the idea of needles, so acupressure is sort of my first go-to. There are cases where you can use needles, I do use needles, but for the most part, babies, young children, even adolescents, I'll use acupressure as opposed to acupuncture. Also, elderly or hospice care, you tend to do more acupressure, which elicits a much greater response than doing acupuncture, which could be painful. Same with sensitive or really scared patients. Fibromyalgia is a great example of this. It makes the skin more sensitive, so sometimes just doing light acupressure has the same effect as acupuncture. Lastly, I would use it and recommend it for homework for patients. Most people come to my office for acupuncture 1 hour a week. And that isn't enough sometimes to get us from point A to point B, their goal with acupuncture. So by doing homework and doing acupressure on some of these same points, it helps to enhance the treatments that we do in the office as well. So what is acupressure really, and how did it come about? Well, acupressure is one form of Chinese medicine. Chinese medicine encompasses not just acupuncture, but Chinese herbs, massage, tui na. It also does cupping or gua sha, if you've heard of those therapies. So Chinese medicine isn't just acupuncture, it also has a whole wide range of uses. But acupuncture and acupressure is one of the things that Chinese medicine is known most for. So how does it work? Basically, when you put a needle or you use pressure on these specific acupressure points, the tissue responds. So in these slides, it's showing that when you put a needle into these specific points, how the tissue actually grabs on. That is what that blue slide is showing, is the tissue grabbing on. And when that happens, your body elicits a response. Basically, it will release adenosine, which helps decrease inflammation, or it will elicit a different response of regulating hormones throughout the body. Acupuncture and acupressure and massage all have the same effect on the fascia and the tissue of the body. Of course, 5,000 years ago, we didn't have functional MRIs and ultrasounds to see what was going on. So they thought of Chinese medicine and acupressure and acupuncture working in the body to create harmony. There's this energy that flows through our body, and we call it qi. And it's our vital energy, it's our life force. And this circulates through our body in these meridians or channels. There's 14 meridians and channels on the body, similar to what we would call arteries, or veins, and they circulate through the whole entire body, and in theory it's filled of our body's chi. When there's trauma or an issue to the body, it becomes blocked, or we call it kind of stagnant. So by doing acupressure or acupuncture, it stimulates that point to sort of open up the floodgates and to allow the chi to flow more properly and balance, and hopefully to create a homeostasis in your body to create health and healing. So what is an acupressure treatment? What does that sort of look like? Basically, we use about 4 to 10 acupressure points, and if I'm using them for homework, sometimes it's only 2 points. I'll just do 1 in each ear. But basically, acupressure treatment is where you take the acupressure point and you will stimulate it for about 10 seconds and release and do that again. And you will use that pressure for about 1 to 3 times, depending on how tender the area is or how it feels for you. And then you would go on to the next prescribed or recommended point. Other points besides acupressure points on the body, there are points also in the ear. The ear represents almost the whole entire body, so it's great for acupressure, especially if you're going to use what we call either magnets or seeds to stimulate those points. Acupressure using seeds or magnets, you can use them in the ear, such as this picture shows, or you can leave them on specific points in the body to stimulate different reactions as well. But most of the time, I tend to leave them in the ears. They stay on longer, and they have a really good effect. So my favorite acupressure points, really I have a bunch of them, but these are some of just my few. For stress, like I said, I love the ear. This point is called Shen Men. It's located right here. You can leave a seed or a magnet in it, and it will stay on for about 3 to 5 days, and then you can take it off and throw it away. Or there's a point right here for stress. It's one of my favorite for insomnia, and basically you can hold this point, take a deep breath, exhale, release, and do it over again. This point is called the yin tongue. Most people know it as their third eye. Next, there's a point for nausea. It's about 3 inches down on the wrist, in between those 2 tendons, and press, release. This point is called pericardium 6. The next point is large intestine 4. And this point is really good for headaches. If you have a lot of pressure in your head or your face from sinuses, this point will oftentimes be tender. Press it a little bit. Again, press, hold, release. Another one of my favorite ones for headache or just neck and shoulder tension is gallbladder 21. Divide your neck and shoulder right here in the traps. Oh, it's oftentimes really tender on people. You can do this. You can do it on yourself. You could also do it on a family member or a friend. Good. Lastly, there's a point on the leg called stomach 36. It's really good for your immune system. It helps to increase your energy, and it's good for digestion as well. If you're interested in learning more about acupressure for specific conditions, follow along, join our course. We have different courses for different conditions, and let's help you to get the benefits that you can use at home. Thank you so much for joining me today. I hope you learned something about acupressure and how it can benefit you.